Hi, my name is Christy Angel. I'm a student physical therapist at Campbell University, and today I'm going to talk about the lumbar quadrant special test. The purpose of the lumbar quadrant test is to assess low back pain with mobility deficits, such as a closing dysfunction, intervertebral foramen pathology, or stress to the facet joint. There has been little research about the validity or reliability of the lumbar quadrant special test. According to the two textbooks referenced below, the diagnostic value of this test is still unknown. One article hypothesized that if they reduced the opening of the intervertebral foramen, they would be able to reproduce the self-reported low back symptoms. And in the same study, the quadrant test had the highest frequency of positive findings during their physical examination compared to all other tests. The lumbar quadrant test is a combination of three motions: extension, side bending, and rotation. According to the evidence, there are two ways of completing the test. Based on McGee's textbook, the patient must be standing, and they should actively move into extension of the lumbar spine, then ipsilateral side bending, and ipsilateral rotation to the side of dysfunction. The physical therapist will guide the patient through this motion by standing on the contralateral side and placing their arm across the patient's chest onto their ipsilateral shoulder. So she's going to go into extension, ipsilateral side bending, and ipsilateral rotation. If there is no pain with this movement, the therapist will apply overpressure through an axial load. This position is held for 3 seconds. So the other way to complete this test is to follow the evidence from the WISE textbook. The only difference is the patient's positioning and the rotation. The patient must be seated, and they should actively move into extension of the lumbar spine, ipsilateral side bending, and contralateral rotation to the side of dysfunction. From this point, the rest is the same as before. The physical therapist will guide the patient through the motion by standing on the contralateral side and placing their arm across the patient's chest onto their ipsilateral shoulder. The patient will then go into extension, ipsilateral side bending, and then contralateral rotation. If no pain has been felt with this active movement, the physical therapist will apply an overpressure through an axial load. This position is held for 3 seconds. The difference between the two positions is that when the patient is seated, the lumbar spine has an increased weight-bearing force on the sacrum, causing a different stress angle than if the patient would be in a standing position. A positive test would be the patient reporting a pre-production of radicular symptoms of numbness, tingling, or pain in the area of the back or lower extremities. So today we're going to do the lumbar quadrant special test. That includes extending, side bending, and rotating your spine. The reason behind this special test is to close down the space that is producing your pain or your symptoms. So a positive test would be reproduction of the symptoms that you came in with today. Okay. I'm going to place my arm on your shoulder. All right, I want you to bend backwards for me, okay, and then go to the side, and then rotate that same direction. Good. Do you have any symptoms or pain in this position?
No.
Okay. I'm going to apply a little bit of pressure here. 3, 2, 1. Do you have any pain or symptoms in that position?
No.
Okay. All right. Will you go ahead and sit down for me? Okay. So we're going to go ahead and bend backwards. And you're going to bend to the same side, and then you're going to rotate towards me. Good. Any pain or symptoms in this position?
No.
Okay, I'm going to apply a little bit of pressure. 3, 2, 1. Okay. Any pain or symptoms in that position?